everyone, Dr. Nemeth here. Today I'm going to be discussing mommy makeover surgery and answer some questions that people have had and presented to us. The first is always, what is a mommy makeover and why do we call it that? After having children, our bodies change so much, and a lot of the classic changes affect our breast and our bellies. So the breast can usually become a little bit more tautic, the skin gets stretched out, we may lose some volume, we may gain some volume, but overall we feel like we need a little bit of a lift or tightening and shaping to our breasts. With the tummy, because of the rapid expansion from having a baby in our belly for about 9 months, we tend to get some stretch marks, loose skin, and something called a diastasis recti. Some people are able to kind of regain and bounce back after pregnancy, but I think when we're not able to do so, surgery is often a good option for us to regain our pregnancy bodies. So a mommy makeover typically entails surgery on the breast, such as a breast lift or an augmentation or both, sometimes liposuction, and often a tummy tuck. The first question a lot of people ask is, how long is the recovery period? It's a great question and it's a little bit different for everyone, but typically in the first few days, you're gonna be moving a bit slow. The first 2 weeks are going to be the bulk of kind of the slowness of the movement and the need to protect your incisions. At about 6 to 8 weeks, these scars are going to have a better durability to be able to withstand more activity. And so that's the period of time when we'll say you can get back to possibly a bit more activity or more regular activity, and it depends. How long will I feel sore? This again is dependent on you, the patient, but for the first week, I would imagine you may need some narcotic pain medication. After that, a lot of people will be able to transition to something like plain Tylenol or regular Motrin at that point, and kind of taper off of any pain medication after the first 2 or 3 weeks. And when is the most optimal time to have a mommy makeover? Well, it depends on you and your baby. It takes most women about a year and a half to kind of recover from childbirth and from labor and getting their body back to a more regular, balanced state. So I would say about that time, we can start having the discussion. And in addition, if you're breastfeeding, I would say no less than 6 months after you finish breastfeeding, especially for surgery on the breast. So we want to make sure that you're as much back to the pre-pregnancy state as you possibly can be before doing this surgery. Will I have visible scars? The answer is yes. I mean, any surgery that is going to kind of tighten up loose skin is going to leave you with a scar, a well-placed scar, and these tend to heal and fade very well with time. But technically, yes, we are exchanging scars for a tighter contour, and there are definitely modalities that we will recommend when you're better healed to help fade and flatten those scars. And that process really gets better and better during the first 1 to 2 years. So you can expect that we will help you through that as well. Can I combine other procedures with the mommy makeover? It's a great question. And again, it depends on the patient, but there can be some other procedures that we can either add into the mommy makeover procedure if it is safe to do so. But the typical surgeries will include surgery on the breast, either with an implant and or a lift, tummy, and liposuction. And realistically, I think for women, mommy makeover is such a great way if we're really feeling like we haven't been able to get our pre-pregnancy body back the way we wanted. It's just a great way to get there. And it's so hard to get your body back when the skin has been stretched because there's not a lot that we can do to get that skin quality back. And so really, this surgery is meant to kind of tighten up the functional aspects like your abdominal core and also remove the loose skin. So I think for most women, mommy makeover at this kind of complement of surgeries can be really, really good options to talk about with your plastic surgeon. And we're happy to discuss it with you and help you decide on the right surgeries for you.